Do you run when you see a spider or scream when you see a snake? Or drive across the country rather than getting on an airplane, even though that plane ride would be much quicker and easier than the car trip? These might be symptoms of a specific phobia, and if you don't know what that is, you have found the right place because that's what we're covering in this video. Let me introduce myself. My name is Keegan. I am in grad school working on my Master's of Counseling. I am in the final months of my degree and hope to be graduating very soon. I have a passion for mental health, and so I'm glad you're watching this video so that we can learn more together. I think the best place to start when we talk about a specific phobia is with the symptoms, because when I'm diagnosing someone with a specific phobia, I'm going to be looking through these symptoms and working with them to get the information that I need related to this to see if this is in fact what is going on. The first symptom that we're going to look for is marked fear or anxiety related to an object or situation. So with specific phobias, there's actually a range of categories that the phobia might fall into, and we're going to talk about that here in a bit. But the biggest thing is that there has to be a lot of fear or anxiety related to that object or that situation, because that is the hallmark of what a specific phobia is. The second thing is that the object or situation almost always provokes intense fear or anxiety. So if a person has a phobia related to spiders, that means whenever they see a spider, that is almost always going to create a lot of fear in them or anxiety related to the spider. For some people, this might be limited to when the object is really in front of them. Like if there's a spider in their living room, that might be something that is more anxiety provoking for them than looking at a picture of a spider, but both might elicit some reaction for them. Third is that the object or situation is avoided or endured with intense anxiety or fear. So this means that if someone has a phobia related to needles and they need to get a shot that's required for work or something like that, they may put that off for as long as they can, and then when they are almost at the deadline or maybe even beyond the deadline for when they need to get this shot, they may then go and get the immunization. However, they may have intense fear related to it that might cause them to scream or to cry or react in other ways that are really hard, if not impossible, for them to control. So going along with this, the fear or anxiety is out of proportion for the actual danger. So if someone has a fear of dogs, they may feel that the dog that they are around is going to lunge at them and bite onto their throat, resulting in their death. Of course, this is a possibility. Someone can be bitten by a dog, and the dog may in fact kill them. However, there are tons and tons, millions, if not billions of dogs in the world. And there are people that are interacting with dogs every day. And yet, it's not often that we hear about really significant and severe dog attacks that result in someone's death. Of course, they do happen, but they're not common. And that's the thing. It can happen, it's really uncommon. But for the person with a specific phobia related to dogs, this fear may seem as though it is 100% surely going to happen to them every single time they see the dog. Fifth, the fear or anxiety related to the object or situation has lasted more than 6 months. Sixth is that the distress or impairment is significant and it really does impair their life in some way. For some people, they might be afraid of spiders. They might have a phobia of spiders in most ways. However, they might not run into spiders often enough that it causes them much fear. Or maybe a better example is cliffs, that someone may not be interested in hiking. They might not be a very outdoorsy person, and so they may have a fear of cliffs or a phobia of cliffs, but it really doesn't impact their life much because it's just not something they're not interested in being outdoors in a situation that would put them in place to be near a cliff. It's also important that the phobia is not better explained by another medical or mental health condition. And finally, it's important to recognize too that we've gone over the symptoms for adults. Specific phobias in children can look different, and so that would have to be a different video. If it's something you're interested in, let me know in the comments. Earlier on, I said that there's various categories that phobias can be in for people. And so the first one is animals. So if someone has a fear of spiders, snakes, dogs, elephants, whatever it may be, that would be an animal phobia. The second is natural environment. Some people are afraid of heights, storms, or water. These are things that would fit into the category of natural environment phobias. Third is blood injection injury phobias. So this could be a fear of blood, a fear of medical procedures, a fear of needles or shots, or of surgery, or something else related to blood, injection, or injuries. Anything in that category could fit into this category of phobia. Fourth is situational phobias. This could be things like airplanes, elevators, or small spaces. And finally, the fifth category is other. And so this could be things like choking, vomiting, or really something else similar or that doesn't fit into other categories that may provoke or really meet the symptoms of a specific phobia. As we've talked about the symptoms of specific phobias, we've talked about some of the things that might happen for people with a phobia, such as having fear that causes them to scream or run or act in ways that are out of their control or would be very, very hard for them to control. There are other things, though, that are common for people with phobias. One might be that they have a lot of anxiety going into a situation where they know they're going to run into the object or situation that they have a phobia related to, or may have the opportunity even to run into this object or situation. The other thing is people with phobias can often have some panic attack-like symptoms as their body revs up when they're in the presence or when they know that they might run into the object or situation that they have a phobia to. And sometimes people, especially with the blood injection injury type of a phobia, may find that they get lightheaded, dizzy, or even faint when they come into contact with the thing that they have a phobia about. For people with a specific phobia, they might hear from other people to just suck it up. It can't be that bad. And these things are really hard for people with a phobia to hear because they may know in their mind that they don't need to be as afraid of the thing as they are. However, it's a disorder because they can't control this. This is something that's really hard for them and that they have a lot of stress, anxiety, and energy that they're putting into this phobia related to the object or situation that they wish they could just not be afraid of anymore. Because of statements like that, people may struggle in social situations because they don't know what to say and they don't know how to explain their phobia. They might also struggle in social situations because they may be very anxious about the object or situation that they have a phobia related to coming up, and that they may then be spending a lot of time and energy, or their mind might be distracted by the thought of what they're afraid of. Certainly, they have a decrease in quality in life because of their phobia. Interestingly, for people with phobias, when they have one object or situation that they have a phobia related to, as that phobia increases, they often will have more things that they become afraid of or anxious about. And so the objects or situations that they have a phobia with will increase most often over time. And of course, people can have a lot of avoidance of things like medical care when they have a blood injection or injury phobia. And for people who are afraid of choking or vomiting, they might actually increase their dietary or their food intake because of that fear. And like with many other mental health conditions, people with specific phobias may be at an increased risk of suicidal thoughts and behaviors. So if you or someone you know is having suicidal thoughts or behaviors, make sure that you go to the emergency rooms so that you can get the help you need. You can also call 911 or 988 here in the US. There is hope. Phobias can be overcome, and actually I think phobias or a specific phobia is one of the most treatable mental health conditions there is because the therapies that we use for this are very effective. So this leads us to what do you do? What are your options if you think that you have a specific phobia or if someone you know might have a specific phobia? Well, first up, you're probably going to need to go see a therapist or a mental health professional to help you with exposure therapy. And I know exposure therapy can be absolutely terrifying for people with a specific phobia because it involves being in the presence of the thing that they have a phobia with or a fear about. And because there is so much fear related to this object, exposure therapy can sound like the worst thing ever, but it's a very effective form of therapy when done right. So although it is anxiety provoking for people with a phobia, I really do think that they will be glad that they did it in the end, and it may even be quicker than they expected to or less painful than they expect it to be. But the biggest thing here is just to start seeing a mental health professional for it and work up to it in the time that you and the professional think is appropriate and is achievable and doable. And you might also find that in some cases a medication is helpful with the anxiety that you're experiencing with your phobia. So definitely check with your healthcare professional for something like that. I hope that this video was helpful and that you learned a lot. Again, if you or someone you know has a specific phobia, there's definitely hope for getting over it. And I wish you all the best of luck with that. Thanks again for watching. And while you're here, why don't you check out the next video?